Hello everybody, and welcome to Species Specifics. Today we're going to be discussing guinea pigs. If you are new to this series, the goal of these lectures is to cover unique diseases of different veterinary species that are specifically mentioned in the ICVA NAVLE study guide. I've also included some diseases that are not specifically mentioned, but may still come up. The focus of these lectures is on disease recognition through images, clinical signs, and diagnostic tests. I've also highlighted key, easily recognizable characteristics in bold. First, we will look at some digestive disorders for our guinea pigs. Guinea pigs are very sensitive to antibiotics because antibiotic use in this species frequently results in a fatal enterotoxemia. Clinical signs include diarrhea, lethargy, and sudden death. Treatment of the enterotoxemia typically involves supportive care and syringe-feeding high-fiber diets to help prevent ileus. Guinea pigs commonly get dental disease affecting their cheek teeth. Usually this results from diets where there is not enough fiber available, so their teeth do not get worn down properly. Clinical signs can include anorexia, difficulty chewing, weight loss, and tielism. You can treat most dental occlusions by reducing the tooth height under general anesthesia. Now we will look at common skin diseases. Mange in guinea pigs is caused by Trichosacris caviae. This mite is transmitted by direct contact or by contact with a contaminated environment. Clinical signs include intense pruritus, alopecia, and hyperkeratosis. You can treat this condition using ivermectin or fipronil. The main cause of dermatophytosis in guinea pigs is Trichophyton mentagrophytes. Guinea pigs are extremely common carriers of this pathogen, with studies showing that up to 15% of guinea pigs may be carriers. Usually animals are asymptomatic, but they may develop areas of alopecia with minimal pruritus. Treatment involves topical and systemic antifungals. Pododermatitis in guinea pigs is usually caused by Staphylococcus aureus. It is more common in guinea pigs that are living on wire or abrasive floors. Clinical signs include swollen and hairless areas on the feet that may develop into ulcers or scabs. Treatment involves bedding changes, antibiotics, and foot bandaging. Alopecia develops to some degree in all guinea pigs during late pregnancy or during nursing. It usually begins on the back and then progresses to the flanks and abdomen. This alopecia should resolve once the sow stops nursing. Chlamydial conjunctivitis is caused by Chlamydia caviae, and it is one of the most common causes of conjunctivitis in this species. It primarily affects young animals between 4 to 8 weeks of age. Clinical signs include conjunctivitis and ocular discharge, and some animals may develop respiratory signs. The main treatment is doxycycline. Cervical lymphadenitis is caused by Streptococcus equis zooepidemicus. This is a normal part of the oral flora that can enter into abrasions in the mouth and thus colonize the lymph nodes. The main clinical sign that you will see are large neck swellings. Treatment involves surgical removal or antibiotics to treat the infection. Trichofolliculomas are the most common skin tumor affecting guinea pigs. They are a benign tumor arising from the hair follicle epithelium. They usually appear as slow-growing masses on the dorsal lumbar or sacral region, and they can be treated through surgical removal. Now we have some reproductive conditions to look at. Pregnancy toxemia occurs during late pregnancy in guinea pigs. Obese sows are predisposed to the metabolic form that primarily results in hepatic lipidosis, while all sows could potentially develop the preeclampsia form. Clinical signs include lethargy, anorexia, and death within 4 to 6 days. Treatment involves intravenous glucose, nutritional supplementation, and cesarean section to remove the fetuses. Ovarian cysts are common in guinea pigs over 1 year of age. They contain clear fluid and can be up to 4 centimeters in diameter. Associated clinical signs include infertility, alopecia, and mucometra. Treatment involves surgical removal of the ovary and its cysts. Guinea pigs have a unique risk factor for dystocia. Their pelvic symphysis fuses at around 6 months of age, and if they have not had a litter before then, that fusion can actually restrict passage during delivery. This typically presents as excessive straining during delivery, and affected sows may require a cesarean section. This can be prevented by breeding the guinea pig prior to 6 months of age so that the pelvis stays widened. Finally, we have a couple other disorders. Bordetella is an aggressive, highly fatal pathogen in guinea pigs. It is usually acquired from carrier rabbits that are housed in the same environment. In guinea pigs, it can cause pneumonia, conjunctivitis, otitis media, and abortions. Some cases may be treatable with antibiotics, but ultimately, guinea pigs and rabbits should just not be housed together for the health of the guinea pig. Guinea pigs are unable to synthesize vitamin C, so they must acquire it in their diet. Diets that are lacking in vitamin C can lead to scurvy, with signs like joint swelling, widespread petechiae, and diarrhea. Treatment and prevention both involve supplementing vitamin C through commercial sources or through feeding high vitamin C vegetables. Finally, urolithiasis. Urolithiasis may be associated with high calcium diets in guinea pigs. It can also occur secondary to cystitis, which is common in older female guinea pigs. Clinical signs include dysuria, vocalizing during urination, and hematuria. Treatment involves surgical removal of the uroliths. Thank you for watching Species Specifics. If you enjoyed this video, remember to like, subscribe, and to share with your classmates. If you're feeling generous, there is also a link in the description below where you can buy me a coffee to help fuel future video making. Thanks again for watching, and we will see you in the next video.